Hello, everyone. I'm Dr. Constance here for another episode of Munch and Learn with Dr. Constance, where I give you short yet impactful health education sessions that are perfect to go along with your lunch period. And if you haven't tuned in before, I always start the session telling you what is on my lunch plate for today. And this one has a story for sure. So, a few weeks ago, I was on Netflix, which many of us love Netflix as our streaming platform of choice. And I came across a documentary, which I actually love documentaries and docuseries, called The Game Changers. And this documentary was all about athletes who had converted to a vegetarian or vegan diet, and how it positively impacted their health and expanded their success as an athlete. And I thought this was interesting because every now and again, I feel that I hit a wall when it comes to my own performance. I wouldn't necessarily call myself a athlete, but I do like to stay active. I've run, I've done CrossFit in the past, I played volleyball and tennis growing up. Um, and I'm in the Navy Reserve, so I have to keep a certain level of physical readiness. And I said, you know what? Maybe I should try something different with my diet to see if it helps me feel a little bit better. And so today's lunch is a vegan meal. Actually, for the last 2 weeks, well, last week and this week, have been trying to dedicate myself to a vegetarian diet, and I'm lactose intolerant. So on a regular basis, I don't do a lot of cow-based dairy products anyhow. And so I made a Mediterranean lentil salad. Excuse me, I'm opening up my container. Probably should have did that ahead of time. And I love to experiment and play with international flavors because it brings a vibrance to the meal instead of a more traditional American, and in my case, Southern approach, which is a lot of just like salt, pepper, onion, garlic, versus a little bit more exploratory. And so it's a beautiful salad, more pretty when I first made it because it was like plated a little bit better. But I did green lentils, um, red bell pepper. There's some green onion, red onion. And if you're feeling sassy, you can also put in chopped tomatoes. I also did chopped parsley, and then I dressed it with a little bit of a balsamic vinaigrette. And I used the sugar-free variety, which I wasn't the biggest fan of, but I rescued it a little bit with a traditional, just straight up balsamic vinegar, which was great. And so next time I'll probably just make my own quickie vinaigrette with a little balsamic vinegar, extra virgin olive oil, tons of garlic, also pepper. I use smoked paprika. So this is a flavor bomb. You get lots of fiber, lots of protein. If I'm not mistaken, there's about 30 grams of protein in a cup of lentils, and you get a lot of fiber. And then you add on the vegetables, and you honestly won't miss the protein because it's so hearty. It keeps you feeling full. So you get the same effect as if you had 6 ounces of your chicken or whatever. So definitely something for you all to consider, is kind of switching things up. We do know that in general, diets that are a little bit more balanced with less emphasis on animal-based proteins and other products, people generally do better health-wise, prevents cardiovascular disease or coronary artery disease, improves blood pressure, improves blood sugar, helps you feel a little bit better, keeps your bowels moving, all of those things. So certainly consider what that might look like for your life. Something that I recommend is, if I had to be honest, I don't know that I want to be vegetarian or vegan myself. However, knowing the benefits of increasing the plants in my diet is certainly worth dedicating a little time and energy to incorporating to everyday life. So even if it's just periods of time, a few days out of the week, or for me, a couple weeks out of the month is the goal that I want to have. So be it, and it definitely will improve your health overall. And so I will transition straight into the topic for today. In fact, May is Mental Health Awareness Month. And so I want to take a little time to talk about this. Many of us know and understand that mental health concerns are highly stigmatized, especially in subpopulations of our culture and around the world. Um, and I believe that things are getting better, but we still have a ways to go. And part of the challenge is people not necessarily educating themselves and fully understanding what it is that we are talking about when we're referring to mental health concerns. Certainly, mental health issues can be as straightforward as, anxiety or depression, which are common things that we talk about. But ADHD fits in the mental health conversation as well. And then you get into things like post-traumatic stress disorder, most commonly called PTSD, acute stress reactions, bipolar disorder, schizophrenia, schizoaffective, borderline personality disorder, many different things that we don't talk about, but also the general public may not fully understand. Today, I actually want to emphasize bipolar disorder. Why, might you ask? As a healthcare provider, in particular, a medical doctor, understanding how big the stigma is behind mental health, I get frustrated when I hear people throwing around certain words. Surely there is absolutely no shame in having a mental health diagnosis. However, it is important that we don't label people and put them in boxes that they don't belong, that if we do have mental health concerns, that we actually take the time to get diagnosed, not us going to someone telling them that we have a certain thing because we believe that to be true, but taking the time to have those conversations and get a legitimate diagnosis. And so the reason why I have a bone to pick with conversations surrounding bipolar disorder is because any level of emotional swing, people are easy to label it as bipolar disorder. I'm just being bipolar today. That's not exactly where that comes from. And so let's take a little bit of time to understand that better. The the way that people casually talk about it certainly is the basis of it. Bipolar disorder is a mental illness that causes dramatic shifts. So we're not just talking about, I'm a little agitated with you right now, and then, I take some time to calm down and I'm good. That's not bipolar. This is dramatic shifts in mood, energy, and ability to think clearly. And people experience extreme highs and then extreme lows, and that the highs are called mania, the lows depression, which we surely understand that. And this is very dramatic of a swing. And just as a frame of reference, I will be using information from NAMI, the National Alliance on Mental Illness. So whenever you get a chance, if you wanted to read more or learn more, you can certainly go to that site and read up on your own. But in particular, bipolar disorder is often diagnosed when people around the age of 25, but certainly it can occur at other stages of excuse me, but certainly less often in childhood. So keep an eye on that as well. It's going to be at least teenage years at the minimum. And much less often in childhood, and affects men and women equally. And there are certainly people who have undiagnosed bipolar because they have not formally gone to a mental health provider or a primary care physician that can direct them in the right direction. And it's important to understand that the symptoms can vary dramatically. You can have symptoms that start in your teens or in your 20s and then have a lull in which you don't have any issues, and then it resurfaces itself. But again, it's typically going to have distinct periods of mania, and then you go into a more depressed state. And sometimes during these periods, people actually have psychotic symptoms. And when I say psychotic, this is referring to having symptoms and experiencing things that don't reflect reality. So this is in which someone may have hallucinations, whether auditory, it could be visual hallucinations, tactile. Sometimes people feel that things are on them that really aren't there, which in that case, it can lead to a misdiagnosis of schizophrenia. So that's something to keep in mind as well. And so with mania, again, that's one of the other misconceptions. It's just this, just that maybe someone is being angry, irrational, which can be true, but honestly, in mania, people are being very impulsive and taking unusual risk. So, and making reckless decisions, like off the wall, right? So how might this manifest itself? It's not as simple as, oh, this person has bipolar because they cuss somebody out for looking at them strange, right? Yes, that is an impulsive behavior, but it's not that simple. It could be that they beat someone to a pulp for looking at them a certain way and then recognizing later that, like, oh my gosh, like that was off the chain. Or it could be, and this is one of the things that were listed when I was in medical school and residency. One of the things we commonly talked about were being more promiscuous than usual, spending money. So getting online and buying a bunch of things and thinking like, oh my gosh, like, running up the tab, going out and binge drinking, staying up all night and having the energy to do so, gambling your money. Those are the types of things that are happening in a manic episode for someone. And then certainly depression, again, it could vary, but during the depression stage of it, people are often debilitatingly depressed. So this means that they're not able to get out of bed, they're not showering. Again, they can't sleep as well. They might be sleeping more than usual. They feel like they're a failure, helpless, guilty, negative thoughts that can even lead to suicidal ideation. So again, surely that can happen in depression, and that's when we call it unipolar depression versus bipolar depression, in which you still have that swing from the mania to the depression. While we know a lot of things, we don't understand everything. And surely we have not found a single cause for bipolar disorder, but there is thought that there can be some genetic contribution to bipolar, that it also can be brain structure and function. Um, and so that could also include, after having a traumatic brain injury, then you might have a swing, and then stress. So high stress situations could lend more to having developing bipolar. The diagnosis is simple yet so complex, and it includes physical examination, conducting interviews, and sometimes ordering labs. Why might we be ordering labs, you ask? Well, we want to make sure that there's not a medical reason for a person to behave in a different way. Oftentimes, in those cases, I'm specifically looking at things like thyroid function, severe swings in electrolytes, anemia, because certainly those things can change the way that we feel. And we use something called the DSM, or the Diagnostic and Statistical Manual of Mental Disorders. That's the, so to speak, the Bible of psychiatry and mental health disorders. And it's always changing. We're always having to go back and edit as we learn more, because believe it or not, once upon a time, homosexuality was in the DSM as a mental illness, right? And so we learn more, we do better, right? The more you know, the better that you can help the people around you. And then also considering that there are actually 4 different types of bipolar disorder. So it's not as simple as having it or not having it. Understanding the nuances of the different types helps to better treat bipolar, which could include psychotherapy, medications, self-management strategies, and complementary health approaches. And in that, essentially, you're including lifestyle changes. So looking at how your eating habits, your exercise habits, your faith-based practices, and also just having support from the community can ultimately help treat you're bipolar. And why it's so important to have these conversations, because, even though a person might have one disorder, does not mean that that's all. Um, Unfortunately, if you suffer from one, you're oftentimes more likely to suffer from other mental health concerns. For example, ADHD is often connected with anxiety, and it becomes a vicious cycle. A person becomes anxious about their inability to focus and follow through on tasks, which then feeds into itself and creates more anxiety, decreased focus because of that change in your approach or your inability to stay on task. And then you move a step forward, and then people self-medicate to make them feel better. And then you can develop substance use disorders or substance abuse concerns. And so I would encourage any of you that has any challenges with your mental health, whether it's increased stress, feelings of anxiousness, feelings of depression, poor interactions with others, please seek out help. There are many resources out there in the community, whether it's your local community, the online community. Even these days, you can find resources on social media, whether it's just people to follow that might understand you better or have active places to be able to send you. Please do not sit in silence. Seek out help and be your best self. I hope you enjoyed this session of Munch and Learn with Dr. Constance. To learn more about mental health concerns, please go to NAMI, National Alliance on Mental Illness, NAMI.org to learn more. Have a great day.